Good morning to you all, dignitaries on the dais. Friends, it's indeed a pleasure for me to be here. Actually, the gentleman who deals with e-health matters in the ministry is another joint secretary, but Gautam kept chasing me up, and since I look after the key flagship program of the ministry, I did decide to join in. Now, I'm sure you're going to have detailed deliberations throughout the day, and people sitting on both sides are people far more knowledgeable in the IT. What I'm going to basically be doing is in terms of how we see the role of leveraging ICT for improving healthcare. Now, I'm very happy with the topic for today's discussion in terms of technology for patient delight. So basically, the focus is really the patient. So how do you empower the citizen? How do you make healthcare easy for him, affordable for him, improve quality for him? Now, one of the key things I feel is in terms of empowering citizens to take charge of their health. And IT can really play a big role. And when I look at the penetration of mobiles and the kind of applications which are emerging every day, I feel that there is a huge potential of empowering citizens to be able to take charge of their life, and IT and mobile health and all can play a big role. I can just say that like we have an application which is called Mother and Child Tracking System. Now we have a database of about 16 crore. And every day it keeps on getting updated, so I have a few lakhs getting added. And now these are children and pregnant women who are there on the database of Mother and Child Tracking System. And we would like to monitor and ensure that the entire range of services due to them are indeed provided to them. And so we work both ways. I mean, we would like to empower the citizens for them to know as to whatever services have become due. The ANC has become due, the immunization session has become due for their infant, and simultaneously we have to tell the service providers that these are the children in this village to be covered in this month's immunization session for different vaccine. Simultaneously, we also started an application which is called Kilkari. Now what it does is that every week the pregnant woman or the mother of an infant receives an audio message, a sweet audio message from one Dr. Anita, and depending on the state of pregnancy or depending on the age of the baby infant, there are in all, 52 plus 26, so 78 messages, 6 months during the pregnancy, after the first trimester, after first 3 months to 9 months, and then 1 year of infancy of the child. Every week, an appropriate message, depending on the state of pregnancy or the age of the baby, is received on the mobile phone of the mother or the parent of the baby. So it's time for complementary feeding to start, or it's time for this immunization to be provided to the baby, depending on the date of birth of the baby or the state of pregnancy of the mother. So this is one way. Now the same thing could then span to NCDs. So you have a directory and of those in different stages of diabetes or hypertension and all, and then one could send them appropriate messages, advice, nutritional advice, lifestyle advice, and so that you are do a lot of health promotion, also a lot of preventive related work. In terms of screening. We are planning to take up on a large scale screening of citizens above 30-35 years of age for NCDs, for hypertension and diabetes and common cancers like cancer of cervix, breast and oral cancers, and then create a database and then create a system of follow-up, so a system of continuum of care which would get facilitated through electronic health records. So now you need to, we have a whole lot of applications, both with the union government and if you combine it with the state governments, because public health is a state subject. So whole large number of states have developed IT applications, and they run in hundreds, and the population they touch is anywhere from a few lakhs to 20 crores. Now, what the problem one is, just to give you a broad sense of application that we have, I shared with you MCTS, where we have more than 16 crore pregnant women and children's database. Then we have NHM for monitoring the TB patients. We have a program for IDSP for forecasting or predicting any outbreak, public health challenge. You have the drug and vaccine distribution management systems, which is being implemented across 24 odd states. You have hospital management systems. You have telemedicine programs. Now we have a very large program on teleradiology for facilitating radio diagnostics. So you have a scenario where your human resource is limited and you can't provide advice from a radiologist in a community health center, which are spread in about 6,000 odd facilities across the country, but you can certainly have them digitized and transmitted and then seen by a radiologist, and then he's able to communicate the advice back online on the same day. So teleophthalmology. Then you have e-Rakt Kosh. Now we have a national application on e-Rakt Kosh, which will capture all the blood banks in the public and private sector. And what we are now trying to do is to try to get all the technologies integrated into the application. So so people who are there on mobile should be able to access availability of blood on the blood bank, the closest blood bank, and the availability of different kinds of blood resource in different blood banks and blood storage units, etc., etc. There are also applications being developed in terms of trying to do this pilots in terms of EHR. So having different facilities and then trying to ensure interoperability of data across facilities. Now you're aware that the Government of India has notified EHR, and there's a big work going on in terms of also notifying metadata and data standards, and that would facilitate and help create applications which will be able to talk to each other, because as I said, we have hundreds of applications, but one major problem that we have is that they don't talk to each other, and they still have not got integrated into the process workflow. So those are issues that need to be addressed. I think Department of IT in the last couple of years has been working very hard to create an ecosystem which will, in terms of trying to create a system which is paperless and cashless. Cashless means not that you don't have to pay, but you don't really have to pay in cash, but through cards and also online mechanisms to pay, and also anytime, anywhere, so the person doesn't have to be physically present there. And you heard various applications in terms of simple things like registration for hospital appointments and all that happening. So we heard in terms of the finance minister talking about a legislation for creating legal backup for Aadhaar, and we would need a system to facilitate and a legal framework, a regulatory framework as well as a facilitatory framework to help ensure that you can have electronic health records while ensuring privacy and security of the data, at the same time ensuring that with the patient's permission the data can be transferred and transmitted to doctors across facilities, and so that you're able to provide timely care and improve quality of care and avoid a lot of duplication, and so it's cost saving and in every way that's going to help. And I think there are deliberations going on in terms of creating some authority which would then help set standards, and also to certify that there is adherence to standards, as well as promotion in terms of promoting adoption of EHR. So those works are indeed happening in the ministry, and my colleague is working on that. I'm very happy that this consultation is happening. We would look forward to any recommendations that emerge out of today's deliberation. We will be very happy to hear from you any ideas, any suggestions which can improve the healthcare delivery, leveraging technology. And I, for one, and my ministry firmly believes that ICT has a potential to really help leapfrog in our healthcare delivery. Thank you so much. Thank you.